Hi friends, welcome back to Growing Mothers. Today we're going to talk about what to pack in your hospital bag. I feel like what to put in my hospital bag was one of the things that I actually researched the most when I was prepping to give birth, and I didn't find a lot of resources that helped me pack a hospital bag that I felt like had everything I needed but wasn't too much. And I think I ended up taking way too much, as my husband, who had to carry everything inside, will definitely agree. But today I'm going to talk you through how to pack your hospital bag with absolutely everything that you need for your hospital stay. So today I broke it down into 4 categories to pack your hospital bag. 1 is things for mama, 2 is things for your husband, 3 is tech items, and the last one is stuff for babies. Alright, let's start with stuff for mom. So I actually didn't really need that much in the hospital. The hospital pretty much provides you with almost everything you need postpartum. So the items that you're bringing for yourself are more comfort items than anything else. So for mom, here are my must-have items. A nursing bra with the nursing pads. You could also do a nursing tank or tee. Pretty much any t-shirt that you can move out of the way for breastfeeding totally works. You also want to have a comfy going home outfit. I recommend something that is not super tight anywhere because your body kind of hurts afterwards. So nothing that's tight in the waist, nothing that's tight just anywhere. I wouldn't do tight leggings or anything. I would really do I wore one of my really comfy dresses home where I would recommend super loose sweatpants and a tee, or even a romper, because then it doesn't put pressure anywhere. But just something that's really comfortable would be awesome. But also bring extra scrunchies or hair ties or whatever you use just to keep your hair out of the way. I would also recommend bringing a bag for dirty things, just to keep them separate in your bag from the clean things. And then it just makes it easy when you get home to just dump everything in there in the wash. Okay, I also brought my own pillow, which I ended up loving because it was just nicer than the ones the hospital gives you. And that was really nice to have in labor, but also in postpartum when I was trying to maneuver and get comfortable and all of that. It just made a huge difference to have that little bit of comfort from home. For nursing, I also recommend actually bringing your nursing pillow with you. It's a little bit annoying to have to carry it, but it is nice because then the lactation consultant that comes to see you the day after you give birth can actually help show you how to position yourself while nursing using the pillow that you're going to use at home. So that makes a huge difference in terms of succeeding with breastfeeding if that's what you want to do. And again, you want your nursing bra, your nursing pillow, and then you definitely want nipple cream. Even though they do give you some at the hospital, it's these 2 little packs that you kind of go through really quick. So if you have one that you prefer, I would definitely bring that as well. A comfy robe for postpartum slippers. So slippers were my best friend, because they do give you socks, but I really preferred having my own hard-soled slippers that were easy to get on and off. And they won't let you really wear any of your stuff while you're actually in labor, I found out. But it definitely was nice to have something other than the hospital robe to wear postpartum. You can also bring makeup if you want it, if you want to look cute for pictures afterwards. You also want to bring your basic toiletries. So for me, that was toothbrush, toothpaste, deodorant, my face wash. I use a vitamin C and a radiant oil on my face, and I brought those as well just because it kind of makes you feel a little bit more human after giving birth. And then you can bring your hairbrush, and if you plan to shower, I would definitely bring shampoo and conditioner. I actually wasn't in the hospital long enough that I felt like showering at the hospital because I was only there 36 hours total. But I think had I been there more than the one night, I definitely would have wanted a shower. So I recommend definitely having your shower stuff. And actually, if you plan to shower, I would bring your own towel because that just is so much nicer than the hospital towel. And also, don't forget your insurance / medical ID card, your ID, and then any medications that you take on a regular basis you definitely want to bring. And don't forget your birth plan. I almost forgot my birth plan. And of course, your birth plan is just kind of a rough guess of what is going to happen, but it's really nice to bring, and I do recommend having extra copies so you can literally just hand them to the nurses, because that just makes it so much easier. Things to bring for your husband. I basically packed for my husband as well because I just do that. I'm a planner. I like things perfectly planned out, and he kind of is fly by the seat of his pants. Would have packed as I was actively in labor. So I would say for your husband, you want to bring enough like clothes for like 3-ish days because you don't know how long you're going to be in there. Comfy clothes. The hospital can be kind of cold, so I definitely recommend like a sweater or jacket for him as well. His basic toiletries, a pillow and a blanket for him. I actually brought my husband a sheet as well, and the nurses thought it was so funny, but he really likes like comfy stuff, so I figured having a sheet to throw over like the hospital couch would be perfect, and it actually ended up being really nice. So he made fun of me for bringing it, but he ended up loving it. Okay, and last but not least, snacks. So that was something that I did for him, and I mean for me as well, because they had a really hard time even finding food that fit our specific dietary needs. So having a bunch of snacks made a huge difference. And again, we basically packed enough for like 3 days because I didn't know how long we'd be in there. And I think we mostly survived on snacks. Also, if you want to bring stuff that needs refrigeration, they actually do have like patient fridges. So if you have specific dietary needs, you can totally bring stuff in a cooler and ask them to put it in the fridge for you. So I would say like if you're gluten-free, dairy-free, sugar-free, any of those fun things, and you're worried about them being able to actually feed you, totally just go ahead and grab a couple things. Even if you have like freezer meals in your freezer to like grab and bring with you whenever you go into labor, that's a super easy thing to bring. Normally we would have just had like food dropped off or brought by visitors, but obviously because of COVID right now, that just wasn't an option. So I think that was something that just preparing that extra little bit really made a big difference. All right, the third category is tech. So this is basically anything electronic. For me, I brought my camera charger, memory cards, but I also recommend bringing like an extra long charging cable because sometimes the beds are really far away from the plug source. So that's really nice, like when you're recovering, to have your phone be able to like be charged but still be with you because everyone's most likely trying to get a hold of you. And then the one thing that I didn't bring that I probably would have liked was my iPad, and I would say like load it with movies or prep it to FaceTime because right now you're basically FaceTiming people because you can't have visitors. So that would have been nice to have that set. Or even if I had been in labor longer than 6 hours, I definitely would have like taken advantage of being able to watch movies. Okay, and last but not least is stuff for babies. So I may have gone a little bit overboard when I packed stuff for the baby. I literally had about like enough stuff for a week. We were there 36 hours, like total. I would say at most you want enough stuff for like 2, maybe 3 days. But because of COVID, they are trying to get you out as soon as possible. So they're letting you go like 24 hours as long as everything's fine. So I would say enough for like 3-ish days, totally good. You're gonna still be overpacked, but don't be like me and pack enough for like a week. It was not a vacation, and I packed like it was gonna be a vacation. Here is what I would recommend having. A couple of outfits, soft, cozy outfits, because they are so like sensitive. They just literally came out of the womb. So soft, warm things they love. You can bring a couple of sleepers. You could bring a couple of like just onesies. I think we just did like some long sleeve onesies. I would also bring a hat. They will give you this at the hospital. You don't actually have to bring anything for the baby, but I wanted something cuter. So like a hat or two. You can bring the mittens. We actually ended up never using the mittens really because he just hates them. But I know a lot of people love the little mittens for newborns. I would also bring a couple of swaddle blankets. We were just going to bring one, and then I thought to bring more, which was good because he had 2 poop explosions while we were at the hospital. So he actually ended up going through all of the swaddle blankets that we brought basically by the time that we were leaving. And then I would also bring like one like soft cozy blanket as well. And obviously you're supervising baby no matter what when you're using any of those things. So you never like leave baby on a soft blanket without washing them. But they're definitely cozy, and they help with like if you're doing skin to skin, it's nice to be able to like cover you both with a soft blanket. I would also bring anything that you want to use for like an announcement photo. So like we brought a really cute little round that I'm obsessed with, that we had made just for him. But you can bring like a little name tag or the little like felt letter board. I know a lot of people do, that's super cute. So whatever you want to use for announcing baby's arrival, definitely bring that as well. And then if you are planning to use a pacifier, I would bring one of those. I know a lot of people don't use them. A lot of people have like weird feelings about using them too soon. If you want to breastfeed, that's totally up to you guys. We ended up using one like 2 days after he came home from the hospital, and we had no issue breastfeeding. So I think that really is just like on a personal basis. But we did bring one to the hospital just in case, and they can be an awesome tool. And if you're not planning to breastfeed, then I would say absolutely go for it to calm your baby, because it definitely is a great soother for them. Just a reminder, in general, the hospital does actually have everything you need. They typically have diapers and wipes and a swaddle and a hat for the baby. They've got pretty much all the postpartum supplies that you could even think of. But I do recommend like taking all of those home with you. So anything that they've given you, like the extra like diapers or the extra like postpartum care stuff for you, just take that all in your bag. You want all of it, just bring it all home, because the stuff you can get at the hospital is so much better, except for the depends are better, but the stuff from the hospital in general, like the creams and stuff that they give you for healing, it's all medical grade, so it's better than the stuff that you can get at home. So definitely take everything that they give you with you. You will not regret filling your bag with those things. Hope you found this video helpful. If you did, please like and subscribe down below, and feel free to ask me any questions. And if you use this video to help you pack your hospital bag, send me pictures. I want to see. Alright, until next time, friends. Bye.